Dr. Spann, can you describe these different categories? Start with the genetic hair eating disorder. It's a hereditary.
Yeah, so the research does say that if someone has the genetic factor to the development of an eating disorder is possible. So if there's a parent or a sibling who has an eating disorder, it does put someone in a higher category of risk for the development of an eating disorder.
And biological?
That's sort of what makes us who we are. And so what we see in those biological factors are things like I might take Tylenol, you might take Advil, that would work better. But that's sort of within our genetic makeup. If we look at how the impact of different psychotropic medications are, how those things work, that impacts an individual as well.
Now, would you say psychological and social are tied together?
They can be tied, but the psychological factors are also what makes us who we are. That's that temperament that we discussed earlier. It also has to do with our understanding of how we make meaning of the world. And so when you think about your kids, that two children who are being raised in the same home, they're just different
They're just
people,
different.
and you just see that. And so those are those psychological factors. It means that who we are as a person is different than the person sitting next to us. The social factors have more to do with our environment and our interactions with the world.
Now let's quickly talk about treating an eating disorder. And as a psychotherapist, how do you determine the severity of someone's eating disorder? I mean, is there a scale?
There are actually a lot of scales to measure the development of an eating disorder and what someone might be struggling with. And so we're doing a wide battery of assessments, including a fully biopsychosocial comprehensive treatment model in our facility, in which we're looking at all of those different domains: the biological factors, psychological factors, social factors, how someone's eating disorder developed, and both why it's continuing today. And we want to target all of those things for eating disorder treatment.
So Dr. Spann, what works?
There's a lot of things that work. And so the answer is that there's not just one thing that works for some people. So some individuals might be more inclined to something like cognitive behavioral therapy, which has specific interventions. Other people might do better with expressive therapies, things like psychodrama, and being able to sort of talk through their experiences in different ways.